chapters that we're going to be reviewing this week is Chapter 6, Psychosocial Development During the First 3 Years. The learning objectives for this chapter are to discuss the development of emotions and personality in infancy, to describe infants' social relationships with caregivers, including attachment, discuss the emerging sense of self, autonomy, and moral development in toddlerhood, explain how social contexts influence early development, and explain how child maltreatment and its effects. Psychosocial development occurs from birth to 36 months in kind of this sequential development that's described in this chart. On one side, you see the age in months. On the right side, you see a description of characteristics that can be associated with development by that age. Let's go down for a couple examples. Age in months 2, characteristics: calm down when spoken to or picked up, look at faces, smile when talked to or smiled at. At about 9 months, some characteristics are that children are shy, clingy, or fearful around strangers, show facial expressions such as happy, sad, angry, and surprised, look when their name is called, show separation distress when a caregiver leaves, and smile and laugh at peekaboo. At about 18 months, we're pointing to interesting things, looking at a few pages in a book with an adult, putting hands out for adults to wash them, and helping adults dress them. So adaptive skills are starting to develop. About 30 months, playing next to and sometimes with other children, showing off to parents, following simple routines such as helping to pick up toys. And then at 3 years, we see them noticing other children, joining in with them to play, calming down within an average of 10 minutes after being dropped off. So that separation distress is lasting 10 minutes or less. Foundations of psychosocial development. Babies share common patterns of development, but also display distinct behavioral tendencies known as temperament. Eventually, temperament becomes personality, which is the relatively consistent blend of emotions, temperament, thought, and behavior that makes a person unique. Psychosocial development is the combination of personality and social relationships across the lifespan. Emotions such as anger and joy are subjective reactions to experience that are associated with physiological and behavioral changes. People differ in how often and how strongly they feel a particular emotion. Emotional development is an orderly process. Complex emotions unfold from simpler ones. There are 4 unique patterns of crying to express 1 hunger, 2 anger, 3 pain, and 4 frustration. By 5 months of age, babies have learned to monitor caregivers' expression, cry harder if ignored, and then stop if the attempt is unsuccessful. A rapid and sensitive response to crying is associated with later social competence and positive adjustment. Spontaneous smiling appears soon after birth, frequently appearing during periods of sleep. Social smiling begins at the 2nd month as infants gaze at their parents and smile, signaling positive participation in the relationship. Laughter becomes more common between 4 and 12 months. Anticipatory smiles are directed at an object, and then the gaze shifts to the adult. This figure just shows us the differentiation of the development of emotions during the first 3 years. So again, we think of them like building blocks. So the first 6 months, we have contentment, interest, and distress that then expand to joy, surprise, sadness, disgust, and onward to anger and fear. From 15 to 24 months, the addition of embarrassment, envy, and empathy occur. And from 2.5 to 3 years, the additions of embarrassment, pride, shame, and guilt are additions. Self-conscious emotions such as embarrassment and envy arise only after children have developed self-awareness. Self-awareness is the realization that one's existence and functioning are separate from those of other people and things. By about 3, children have acquired knowledge about societal standards, leading to self-evaluative emotions of pride, guilt, and shame. Toddlers seem to naturally engage in altruistic behavior, which is activity intended to help another person with no expectation of reward. Sharing, comforting, and helping may reflect empathy, which is the ability to see oneself in another person's place and feel what the other person feels. Brain cells called mirror neurons may underlie empathy, but this hypothesis lacks empirical support as of yet. Temperament. A child's temperament is their characteristic disposition or style of approaching and reacting to situations. Some babies are fussy, other babies are happy and placid. The New York longitudinal study followed 133 infants into adulthood and identified 3 categories of temperament. These are considered temperamental patterns. Easy children, described as generally happy, have regular biological rhythms and are open to experience. Difficult children, characterized as being generally irritable, have irregular biological rhythms and have intense emotions. The third category is slow to warm up children, who generally are generally mild but hesitant to accept new experience. So a lower temperament intensity, but more resistance to new experiences. The key to healthy adjustment and attachment is goodness of fit, which is the match between a child's temperament and environmental demands and constraints. Can also be applied to the match between a child's temperament and the cultural milieu or environment that child is born into. Behavioral inhibition refers to how boldly or cautiously a child approaches unfamiliar objects and situations. When presented with a new stimulus, inhibited babies become aroused, they arch their backs, they fuss and cry. Uninhibited babies are relaxed, they calmly stare at the stimulus and show little distress. These patterns persist over time. Experience moderates them and accentuates these early tendencies. Infant care practices and patterns of interaction within the family vary greatly around the world. In Western, educated, industrialized, rich, and democratic cultures, parents may or may not have the option to stay home with a new infant on leave. In cultures where infant mortality is high, parents keep their infants close to them, respond quickly when they cry, and feed them on demand. In some societies, fathers are more involved in their young children's lives than in others. In the United States, fathers' involvement in caregiving has increased dramatically as more mothers work outside the home and concepts of fathering have changed. A father's frequent and positive involvement with his child from infancy on is directly related to the child's well-being and development. Gender refers to what it means to be male or female. By 3 months, a preference for sex-typed toys appears. Boys as young as 17 months play more aggressively, and girls show better self-control and inhibition. Fathers especially promote gender typing. the socialization process by which children at an early age learn appropriate gender roles. Fathers treat boys and girls more differently than mothers do, even during the first year. More concerned about sons conforming to stereotypes, more of a rigid expectation of how they'll fall into gender norms. The highly physical play style of U.S. fathers is not typical of fathers in all cultures. Erik Erikson argued that each stage in the lifespan has a specific developmental challenge. You learned all about those stages individually when you took general psych. Specifically, a baby's first challenge is forming a basic sense of trust versus mistrust. The critical element is sensitive, responsive, consistent caregiving, particularly when it comes to feeding. Can the baby count on being fed when hungry? If successful, the baby develops trust and hope. When unsuccessful, the baby is mistrustful and has trouble forming quality relationships. Attachment is a reciprocal, enduring tie between two people, especially between an infant and its caregiver, each of whom contributes to the quality of the relationship. Harlow's monkeys experiments looked at attachment resulting from comfort and contact rather than food. And if you remember, those monkeys chose comfort and contact over food almost every time. Patterns of infant attachment are studied in a laboratory technique called the strange situation. Stranger anxiety is wariness of strange people and places shown by some infants during the second half of the first year. Separation anxiety is distress shown by someone, typically an infant, when a familiar caregiver leaves. There are 4 types of categories of attachment pattern. First, secure. The child's behavior that matches with a secure attachment pattern is they're upset when the caregiver leaves and they're happy when the caregiver returns. An avoidant attachment pattern will present as a child who is unaffected when the caregiver leaves and deliberately turns away when the caregiver returns. An ambivalent attachment pattern will present as a child hovering over the caregiver and then who is angry when that caregiver returns. A disorganized attachment pattern will present a child with contradictory responses, confused and afraid. Long-term effects of attachment. Securely attached children tend to develop good relationships with others, have larger, more varied vocabularies, be more curious, competent, and get along better with other children, and experience close, stable friendships in adolescence and healthy romantic relationships in adulthood. When we think about attachment theory and think about the way that the research was conducted, we have to identify that the theory is built in Western educated, industrialized, rich, and democratic theory, that it was only within those considerations, and that the strange situation that was conducted is not a universal barometer for how healthy attachment to a caregiver is demonstrated. It is a barometer of how it is demonstrated within that structure. Western, educated, industrialized, rich, and democratic. Attachment theory is assumed to be universal and applicable to all families, which is a dangerous assumption that has resulted in children being separated from parents and other negative consequences. Mutual regulation is the process by which infant and caregiver communicate emotional states to each other and respond appropriately. Ideally, they experience interactional synchrony, an unconscious coordination of behavior in a rhythmic back and forth manner. Still-face paradigm experimental methodology measures interactional synchrony. A lack of synchrony leads to distress. When interactions are synchronous, the baby is joyful or at least interested. When babies check in with their caregivers upon encountering an ambiguous event, they are engaging in social referencing. Social referencing is seeking emotional information to guide behavior. As children age, social referencing becomes less dependent on facial expression and more dependent on language. So you won't always see the turn toward the caregiver because now the back and forth social referencing can happen just within the context of language. Self-concept is one's sense of self, a descriptive and evaluative mental picture of abilities and traits. By 3 months of age, infants pay attention to their mirror image. Self-awareness emerges between 18 and 24 months. By 20 to 24 months, toddlers begin to use first-person pronouns. Brain maturation underlies development of self-representation. Window on the world. So looking at something that we consider a developmental norm and whether or not that is typical across outside of our nation. The terrible twos are not universal. In a cultural study, American mothers regarded toddlers as capable of misbehavior and punished them, while most Guatemalan mothers did not. American parents believe responsible behavior develops through competition and negotiation. Mayan parents believe responsibility develops when children are old enough to understand the need to respect others' desires and their own. Development of autonomy. Children seek independence. Erikson argued that between 18 months and 3 years, children enter a second developmental challenge, autonomy versus shame and doubt. The virtue that emerges during this stage is will. Socialization involves the development of habits, skills, values, and motives shared by responsible members of a society. Internalization of these standards involves accepting external societal standards as one's own standards. At around age 2, children show self-regulation, which is independent control of their behavior to conform to what is expected of them by others or society as a whole. One goal of parenting is the development of a child's conscience, the ability to refrain from certain acts and to feel emotional discomfort when standards are violated. Situational compliance is obedience only in the presence of an external authority figure. Committed compliance is obedience of a parent's orders without direct reminders. Receptive cooperation is a child's eager willingness to cooperate harmoniously with a parent. Sibling disputes and their settlements are socialization opportunities in which children learn to stand up for principles and negotiate disagreements. Lessons and skills learned from interactions with siblings carry over to relationships outside the home. Infants and toddlers show interest in people outside the home, particularly people their own size. During the first few months, they look, smile, and even coo at other babies. Toddlers learn by imitating one another, leading to more frequent verbal communication. Cooperative activity develops during the second and third year. Conflict helps children learn how to negotiate and resolve disputes. Labor force participation by mothers has increased dramatically since the 1970s. Slight declines attributed to COVID-19 as unemployment increased and mothers stayed home with children. In general, the more satisfied a mother is with her employment status, regardless of what that status is, the more effective she is likely to be as a parent. Overall, children in dual earner families that each parent earns an income do well. Childcare. About 60% of children under 5 have some sort of regular childcare arrangement. About 38% of those children are cared for by relatives, and 20% are cared for in a private home by a non-relative. Factors that impact childcare include structural characteristics like staff training and child to staff ratio, and process characteristics like warmth and sensitivity of the workers, as well as the appropriateness of the activities. Cultural variations in early childcare. In indigenous and pastoralistic groups, such as in Africa and in India, child care generally involves unpaid family and community assistance. In the United States, working mothers often must seek assistance in the form of child care provided by non-kin, so non-family members. In Western countries, about 83% of young children are enrolled in preschool, but only about 22% are enrolled in low-income countries. Maltreatment is the abuse and neglect of a child and can take several forms: physical, neglect, sexual, and emotional maltreatment. State and local child protective service agencies received an estimated 3.9 million referrals for alleged maltreatment of 7.1 million children in 2020. Sex trafficking is a specific type of maltreatment involving the recruitment, harboring, transportation, provision, or obtaining of a person for the purpose of commercial sex. Maltreatment in infancy and toddlerhood. Babies who do not receive nurturance and are neglected sometimes suffer from non-organic failure to thrive, which is a slowed or arrested physical growth accompanied by poor development and emotional functioning. Poverty is the greatest single risk factor. Shaken baby syndrome is a form of maltreatment in which shaking an infant or toddler can cause brain damage, paralysis, or death. Figure 2 shows us the percentage of deaths due to maltreatment by age in the year 2020. Characteristics of abusive and neglectful parents. In 2020, slightly over 77% of perpetrators were the child's parents, with slightly over half women. Maltreatment by parents is a symptom of extreme disturbance in child rearing, usually aggravated by other family problems, including poverty, lack of education, alcoholism, depression, or antisocial behavior. Geographical and economic factors influence rates of abuse. Child abuse rates are lower in countries in Europe and Asia, and high-income countries had lower rates of neglect than low or middle-income countries. In many countries, the use of physical force is normative and not seen as abuse. In some countries, leaving infants in the care of young siblings is routine, while the same is considered neglect in other countries. Long-term effects of maltreatment. Sexually abused children often grow up with higher risk for engaging in risky sexual behavior, juvenile delinquency, and alcohol and drug use. Nonetheless, some abused children show remarkable resilience, in particular when they're connected with the support and treatment that they need.